How do you contact nosocomial through this process? It is a process whereby after a surgical process or a surgical operation, the materials that is being used for the operation was not properly cleaned. Now nosocomial comes to grow in these materials. When a healthcare personnel comes to clean up these materials, without the personal protective equipment like gloves and nose masks, the person tends to contact this nosocomial. And when the person contacts this nosocomial and you do not use disinfectants to wash your hand thereafter cleaning these materials, you pass this nosocomial to your fellow workers and to the patients in the hospital. Now, which other way can someone contact nosocomial infection with this surgical site infection? Now, when the patients who went through this operation, now when the wound is not properly cleaned up for days, nosocomial grows in this wound. Now, when the healthcare personnel come to dress this wound, if they do not come with personal protective equipment, they tend to contact this nosocomial infection and they carry it out to the hospital. When they touch the hospital ray, they leave the nosocomial there. When they touch the bed linings, they leave the nosocomial there. So when other patients or patient visitors touch the same ray or the same hospital linings, they carry this nosocomial infection. So if you go to the hospital and you visit, maybe you're a sister or a brother that is ill, that is in the hospital, please, after the visitation, make sure you use a disinfectant to clean your hands or to wash your hands. Good afternoon, good evening, depending where you're watching me from. I am still your humble health personnel, Augustine Catherine. Today we'll be talking about nosocomial infection, also known as healthcare associated infection. This is an infection that occurs when a patient is being admitted in the hospital. Remember, you do not come to the hospital with this infection. You only contact this infection when you are admitted in the hospital. Now, what are the causes of this nosocomial infection? One of the ways you contact nosocomial infection is through urinary catheter. Urinary catheter is a tube inserted through the urethra to the bladder that helps us pass urine for people who cannot urinate freely. Now, how do they contact this nosocomial infection? Through this catheter. This is when the catheter lasts in the bladder for a long time, for like a day or two. Then this nosocomial grows in this catheter. Now, when the healthcare associated infections or the health workers come to remove this catheter, they are supposed to come with their personal protective equipment like glove, nose masks. In as much as they are trying to remove this, they are supposed to be careful so that the infection that have grown in this catheter will not be passed to the patient or to the visitors that came to the hospital to visit their patients. Now, which other ways can this nosocomial infection be